everybody. Welcome back to the main stage. I am here with Dr. Grant Price. He is from the Lincoln Way Animal Hospital. And we are here for our Ask a Vet session. Hold on while I mute myself over here on the main stage. That did not work. There we go. So this session is guided by you guys, the attendees, truly. So when I mentioned this session earlier in the morning, I had some messages right away saying, I've got this question for Dr. Price. You know what? There was another question that came through too that we were talking about. Let's start with that one, Dr. Price. Once I do a little introduction of you, we will dive into how long a pig should be in isolation. So we've heard a couple different answers, and we would be curious to know what yours is as well. So here's some information on Dr. Price. Dr. Price graduated in 2017 from The Ohio State University with a bachelor's degree in agricultural, majoring in animal sciences. He went on to earn a doctor of veterinary medicine in 2022 from The Ohio State University. Dr. Price's professional interests include food and animal reproduction, small and large animal surgery, herd health, and show livestock. Dr. Price is active on the family farm, including commercial, show pig, and grain production. And he resides in the Tiffin area, Tiffin, Ohio, with his wife, Kylie, and his two children, Callahan and Sutton. And we were just talking backstage that his wife and my daughter spell their name the same way, Kylie, which is just a little bit of a unique spelling of Kylie, Kylee. So that was kind of a fun connection that I made with Dr. Price here backstage. All right, Dr. Price, tell us your thoughts on isolation. So you bring your pig back from a show, or you're bringing a new pig into your herd. How long does that need to be?
Well, it's kind of multifactorial. So I tell clients you're either going to abide by strict biosecurity measures or you're not. You can't pick and choose things. Well, we're going to go jackpot this weekend and we're going to bring our pigs back home and we're going to put them back in the chip barn. That's not isolation. So it's challenging because some families decide not to jackpot and bring pigs home for the summer. But all in all, as far as if you're going to isolate, which I would suggest if you have sows and you're planning on bringing pigs into the world on your farm and you care about them and you don't want to have disease issues, you need to isolate. General rule of thumb is at least 4 weeks. I suggest to all my clients if you isolate and don't test, mainly for infectious viral diseases that we are dealing with, like PRRS and influenza, if you isolate and don't test, 2 months in isolation. If you isolate and we can test in 2 weeks or 4 weeks, as early as you want, I usually tell them to let them sit for 2 weeks, and then we can pull blood or hang ropes and send those to ODA or wherever you choose, and make sure they're not shedding virus. So our PCR test. And if they're not shedding, then they can come into the herd.
Okay. So you're saying 4 weeks and longer if you don't test.
Yeah. Yes. At least 4 weeks, because we'll have some pigs, depending on their exposure. Say it's a boar you buy at World Pork Expo, you bring him home and that pig is positive, like a CT count of 12 on PCR for PRRS.
Mm-hmm.
We'll retest him in 2 weeks. He might be at 23. Then we'll test him again in 2 weeks. He might be at 30. He's still shedding that whole time. That's more information than you need to know. The key is every pig is different. So especially naive pigs that haven't seen a modified live vaccine and they pick up PRRS, primarily that's our main issue, at a show or you buy off another farm, they are all going to handle things differently. We've had boars that will be in isolation for 4 months.
Okay.
So a month minimum is usually what I'll tell people.
And testing is a really good way to determine whether or not they're ready to be out of isolation.
It is the only way.
Okay.
It's the only way to know, because otherwise you're just guessing. Well, he's been here for 28 days. He's ready to roll, or she bring her into the herd, and then it's all the time. we brought somebody into the farm from ISO. We didn't test because we're trying to cheat or be cheap or whatever it may be, and then we have 12 sows aboard over the weekend. Well, now we're testing, and we're testing a lot, and you are dealing with financial issues because you're losing a lot of money, whether it's commercially or show stock. You're dealing with the burden of it. I mean, it's not a great feeling to walk into that farm that morning. So,
No.
and yeah, and working with your vet is going to help you. But test if you're going to isolate, please test.
Okay. That's great feedback here. Okay, we've got questions coming. They're coming. So we're gonna go with that. Let's pick up this question that I got earlier today. And what are some vaccines that should be given to moms and babies? I've seen several different PRRS vaccines. What would be a good whole herd vaccine? So that kind of picks up on what you were talking about here with PRRS, but tell us what you think about that.
If you have show pigs, you should be vaccinating for PRRS because they are going into a world of unknown disease status. They're not like the commercial pigs where we are trying to keep them clean.
Mm-hmm.
They take to the county fair or a jackpot. They have exposure all over. We want them to do well. We want them to be healthy. Vaccines are good if they work. Some vaccines, commercial vaccines, are better than others, but any modified live vaccine is going to stimulate enough of an immune response to give that pig some sort of immunity. Okay. Um, what we are using, and the other thing is there's a lot of issues with what strains we see in determining what modified lives we use. And we don't just use modified lives; we use autogenous killed bacterians or vaccines as well. But we use a lot of BI's 3-flex vaccine, which is PRRS modified live with Circo and Myco. So
Okay.
Mycoplasma virus, type 2. Um, we use a lot of 3-flex, and on our farms, I suggest those farmers producers when they do the pigs anywhere from I like to see them done it 14 to 21 days prior to weaning. They do the pigs and they do the sow in that crate as well. So
Okay.
she's got her dose. All babies are done. I generally follow up with a killed autogenous vaccine that has multiple lineages 2 to 4 weeks later. And that
Okay.
usually works well for coming out of the nursery.
Okay. Okay. Pause. Help me out here. We're gonna speak in bring that down to
Oh,
10.
autogenous.
So we're gonna vaccinate our babies 14, 21 days before
Yeah.
weaning. We
Well,
are
day
gonna
14
day
to 20.
14. Okay.
Yeah.
And we are going to vaccinate them with what did you call it?
3-flex is
Flex.
what we are using a lot of right now.
Okay.
And that might change next year. It just depends on what we are finding.
Yep.
But we use a lot of 3-flex. It's 3 bugs in one.
Mm-hmm.
Makes it handy because you're giving less shots. That's a modified live PRRS virus. So it's going to act like a live virus in the pig, but it's not infectious.
Okay.
So it will shed some virus and you'll pick it up on PCR test. We also use autogenous or killed viral vaccines. And we'll booster those babies. Once they're weaned, they go into a nursery or a chip barn, usually a nursery.
Mm-hmm.
When they come out, about 4 weeks later, we will booster them with that killed autogenous vaccine.
Okay.
That'll just help broaden the immunity.
Okay. That's great. That is a great answer. Okay. Let me check these questions here. We are going to go to, because we're kind of in this farrowing area. We're going to say, what are some meds to have on hand when you're farrowing?
Okay. Oxytocin,
Okay.
Banamine, dexamethasone, Polyflex, Baytril, acepromazine, if your sows are really waspy. That'll be the basics. If you're in trouble and you have those, people can help you.
What does waspy mean?
Crazy.
Okay.
Cows
Thank
that
you.
jump 8 gates.
Okay. Okay.
Sows that like to eat pigs. That's where acepromazine comes in.
Okay. I think that Cynthia, if you're still listening, that kind of answers your questions. If you have more, drop them in the chat by all means. But Tammy now has some questions as well. Okay, Tammy says, what are some things you should look for when buying a pig from a farm to know if it's a healthy pig versus obvious signs of disease or issues?
I feel like you answered it. I mean, obviously, you want them to be thrifty. You want to be full bellied. Hair coat looks good. Eyes are clean and clear. Not thumping when they're breathing. Pneumonia is their number one issue that we see in livestock in general. So
Mm-hmm.
make sure they're not thumping, using their belly to breathe. Things like that. Yeah, not lame, swollen joints, big lymph nodes. Yeah.
Can you describe this labored breathing for us, like really layman's terms? So belly breathing.
Yeah, so I call it thumping. I guess that's what a lot of people call it.
Yeah.
Like you watch a pig laying down or standing there, they're gonna be using their belly to ventilate
Okay.
because their lungs are so edematous and inflamed from some sort of pneumonia, whether it's a bacterial or viral or both. Um, they're having a hard time getting that ventilation process, the room air into the deeper tissue of the lung. So they use their abdomen muscles to breathe, and you'll see them work hard to breathe, and so we call it thumping.
Okay. That is a great definition explanation. I appreciate that. I appreciate that. Um, okay. What is the normal temperature of a pig, and at what high or low temperature should you be concerned?
So rectal temps are good. It I don't let people get I don't want people to, rectal temps are good, but
Okay.
read the sow. Like say a sow in a fairing house. If my sows are generally outside and it's 22 degrees today, and I load her in the fairing house tonight, tomorrow her temp's going to be a little bit higher than normal. If she's over 1015, I would consider her feverish. But is she eating and is she drinking and is she breathing normal? Is she going number one and number two? Is she getting up when she needs to get up? Is she laying down when she needs to be laying down? Those are important. Those are more important to me than somebody says, "Hey doc, my sow's temp is 1021." Okay, what made you take a rectal temp? Because I have some clients that they like. I think they just walk around every day and rectal temp things. And if you go looking for things,
Okay.
you're gonna create more issues that might not be there. A sow with mastitis might not have a temp if you catch it early enough. She's generally gonna lay on her belly and not let pigs suckle and not have a high temp. So, and sows in a 75 degree post labor, 75 degree Fahrenheit post labor, calcium mobility is started. They're going to be feverish naturally with two heat lamps right beside their butt cheeks or their bellies that are 95 degrees on the floor of the crate where they are.
Mm-hmm.
I bet they're going to be a little warmer than they would be standing in 20-degree weather. So read the creature.
Okay. That's a great answer. Um, okay. What about this? Any checklists of what one should keep in their pig first aid kit?
Banamine,
Banamine.
dexamethasone, Polyflex, Batril, 16 gauge by 1 inch needles, nylon syringes, multi-use syringes,
Okay.
uh, super glue. I mean, I don't. Yeah, I mean, drugs, and being able to administer drugs should be your first aid kit, in my opinion. Like, you're
Okay.
not gonna. You carry around suture and band-aids is probably not gonna work, be beneficial for you. So drugs and yeah, maybe
Okay.
iodine, something like that.
Okay. Tammy also asks, routinely deworm, and if so, what is your cadence?
What? Show pigs, sows in the fairy house, sows in general.
I don't know that I have any. Let me look back just a little bit. I don't.
I can
Tammy said way earlier, she said, just purchased 2 feeder pigs to add to my little farm. So that's kind of where Tammy's coming from. So not necessarily show pigs, it doesn't look like.
Yeah. Depends on if they're outside, if they're on dirt and they're breeding stock or growing stock that you're trying to get to market weight, you wouldn't be wrong. In pens that have had pigs in them previously, it wouldn't be wrong to run feed grade Safeguard or Panicure in their feed monthly for two to
Okay.
3 days. You know, yeah, that would not be wrong at all.
Okay.
So
So you would use a feed grade dewormer.
yeah, if they're like sows out on lots, I use feed grade dewormers in our farrowing house and farrowing house ration. I like to deworm sows in the farrowing house and get our mange control done in the farrowing house. From a management standpoint, it's a lot easier. So ivermectin or Dectomax on incoming in the farrowing house, safeguard in lactation diet to deworm them, clean them out.
Mm-hmm.
Getting giving injections to sows in a farrowing crate is significantly easier than a 5 acre lot.
Yep. I believe that. Okay. Okay. Um, okay. If you guys have other questions here, I've kind of blown through Tammy's questions. Tammy gives you a thumbs up, Dr. Price. And actually, she gives you a thumbs up for all of those.
Good.
Carl Blake is asking, how do you deal with mange?
Ivermectin once a week for 3 weeks. Every swine on the premises.
Okay.
I see that every single day, all summer long.
That's what you did all summer long.
All summer. Every show pig. Yes. So if they're itching, treat it as mange. It is mange until proven otherwise. And in order to get them under control, Dectomax or ivermectin injectable, you give that once a week it's easy to remember. 1 per 75 pounds, IM once weekly for 3 weeks. And then if you really want to do help a lot, I think Prolate works very well as a permethrin, 2 ounces to two. I think it's 2 ounces to a gallon, and you spray that topically. Don't go overboard with the Prolate; pigs will have seizures. But if
Don't
you
go.
do, don't go overboard. Don't go to 5 ounces. More is not better in Prolate's case. If you have mange and you only treat one pig in the chip barn, your show pig pens chip barn setup, and it's anywhere in the barn, and you don't treat the other 10, those other 10 will get mange sometime, and you will fight it all summer long, and you will run out of days because of withdrawals and things like that. Prolate alone will not get rid of mange. You have to use ivermectin, and you can get away with 2 doses if you give it 10 days apart, roughly. It's just easier for clients to remember to do it once a week for 3 weeks.
Okay.
You got to kill different larval stages. Ivermectin doesn't work on the lower couple, so we have to give them time to become adults, and then ivermectin will kill them.
Okay. That makes sense. Okay. Mange and mites. This is my question. Same, different.
Mange bite.
What? It's
Yeah.
the same thing?
Same creature, yeah. I
Okay.
mean, there's things like chiggers and other insects that'll cause redness localized. But if I walk into a farm and I see scaliness in the chest, in the inguinal or belly region of a pig, particularly forearm on the front side of their legs, their rear legs, and in the crest behind on their neck through their withers region between their shoulder blades, it is mange until proven otherwise.
Okay.
Treat them.
Okay. Okay. How many different kinds of mange are there, and can you see them all with the naked eye? So that it's kind of sort of answered maybe like if they're itchy, it's mange.
Yeah. I have never been able to see them with my naked eye, but I would. Maybe you could if you tried real hard.
Okay.
I don't know. There are all sorts of different mange, and I don't know. I don't remember the scientific term of the mange that we deal with here in North American pigs. And there's a bunch of different mange mites that cause big problems and are reportable to the USDA. So
Okay. Julie Christie asks, weaning show pig feed management. What are your ideal protein levels?
So weaning pigs, I step back into the farrowing. I like to creep pigs for 2 to 3 days prior to the weaning process. Before that, I feel like they waste most of it. We just want to get them interested in feed. So when we wean them, they don't really skip a beat. I can pull you up my diets and tell you what the percent on we call it a pre-starter on our pre-starter that we creep with. Pellets are nice. They're more expensive than a ground feed. We use a ground feed because we have it made commercially. but you're going to be 22+% on your pre-starter. The big thing is it needs to be, we're going to be using more milk proteins and less soy protein in that pre-starter diet and into the starter diet. When we get into past that 50-pound range, we're going to be most of that protein is going to be coming from the soybean meal and an amino acid, vitamin mineral packs. Yeah, so our protein on our starter is 20.4%.
Okay.
22 to 24, most of those pre-starters. All of them are different. Look at Lindner for the show pigs. You know, Lindner, Sunglow, Umbarger, Mormon's ADM. All of them are going to be a little bit different. The biggest problem I see with pigs on weaning pigs and problems in relation to feed is people feed the pre-starters way too long. High protein for too long causes enteritis or GI burnout.
Mm-hmm.
So dogs can't handle that much protein.
Okay.
So changing them, like on our farm we do 3 pounds of pre-starter per pig before they go to starter.
Okay.
So once they get in the nursery.
Okay. Um, I am gonna have to apologize. I do not know how to say your name. Um, so Miss Marino, I'm gonna try. Do you have any advice to farrowing in a barn that's colder than what we had hoped? Our new barn is still under construction and will not be ready in time for farrowing. So when it's colder, you don't have your 75-degree farrowing house. What do you do?
Well, I mean they can do it. They did it for a long time in the A-frames in the woods. Mortality is usually higher than we'd like. The biggest thing is keeping the draft off of them, and plenty with pigs. We can make up for a lot of room temp by allowing them to use their body temp with insulation like straw and things like that. If you have power in the building that you're farrowing in, I would definitely have heat lamps. Um, if you keep a heat lamp with a 175-watt bulb about 20 inches off the ground, it'll be 95 degrees. So you can make some zone heated areas. You can
Okay.
also use heat mats and things like that that are electrical, but keeping the draft off of them. So
Okay. That's great. Tammy asks, this is a great question. Is
Tammy
there a
thinks
national database to help find pig vets in the area or available virtually? I don't have a small livestock vet around that I have found for my goats, so I suspect that she'll have the same issue with her pigs. She just got these 2 feeder pigs.
mm, not to my knowledge.
Okay.
Not to my knowledge, but you can talk to local vets. I mean, some of them probably wouldn't suggest other vets because whatever reason. But yeah, I mean, you can talk to breeders or people that have pigs to see who they use. But yeah, that's a big problem. I mean, we go all over the place. So we're
Yeah.
all the states touching us: Texas, Oklahoma, yeah, Florida.
Okay. Um, okay. So that is taking care. Oh, somebody, she said that her barn is draft free. There's power and they have heat boxes for the piglets planned. So
Awesome,
sounds like they've got a pretty decent setup going on.
rock and roll.
Um, Carl Blake is suggesting that you can get vet information if you go to his Facebook group, The Pastured Pigs for Meat and Profit. You might be able to find some different people in your area that way. Um,
Facebook, yeah.
yeah. So we've got like, I don't know, 1-ish more minutes left. So, because we were just talking about farrowing, tell me what the biggest mistake you see in farrowing is. If you could get somebody to change this one thing.
The biggest mistake, well, the biggest mistake I see on the farms, especially show stock or small farms, is sows are overweight. They're overconditioned.
Okay.
That's what I see. Sows are too heavy. Overweight creatures don't do well in the reproductive or lactation department. So they need to be skinnier, in my opinion. We see that they look healthy, but they don't do well as far as putting babies on the ground and then getting them to weaning weight and then recycling back to get bred again. Yeah, that would be my biggest issue. We see that all the time. is sows are too high of a body condition.
Okay.
So I'm not saying they need to be emaciated, skinny, but most sows that I see in the show pig world, particularly, should not weigh 650 pounds. If you have to struggle to get the door closed in the back of the crate, she is too big.
Okay.
So, but that takes management months prior.
Yeah. 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 That makes sense. That makes sense. Trying to think if any of my other questions that I had prepared are. So you did a great job talking about belly breathing. I'm looking at my respiratory question here. What are we looking to identify an issue? And then once if you see that belly breathing, if that you talked about seeing the belly breathing before you bring a pig onto your farm. What do you have a recommendation on when you see this respiratory issue come up? What do you say? What's your next step? You're like, what are you trying to ask, Jen?
my question would be, what drugs do you have?
Okay.
Yeah. So anti-inflammatories, dexamethasone is a steroid, and Banamine is a non-steroidal fever reducer, anti-inflammatory. And then I usually use like a macrolide, like Draxin. And then I'll use something daily to follow up with the Banamine and Dex for 2 to 3 more days, 2 days on the Banamine, and usually 4 to 5 total days with Polyflex or Baytril, or Naxel or Xnel, whatever they have. We will use something broad spectrum though. That's for show pigs. We get fairly aggressive with them.
Okay.
So commercial
That's
pig,
fair.
we wouldn't go that route. But
Okay.
can I add something?
You can add all the things.
The biggest thing that I see with producers today is they don't have a good veterinary client patient relationship.
Okay.
Use your veterinarian. Yes, they are going to charge you, and yes, they should charge you because they need to be able to buy hot dogs in the week too. But if you want to call them and text them and email them and send carrier pigeons with your letters about all these other things, you need to use your veterinarian. Have one. Use them as much as you need them, but have a relationship with them. Get them on the farm because 90% of the things that I see on the farm are management issues. How warm is your farrowing house? 64 degrees. Why? You called me here because pigs are scouring. Well, they're scouring because they're cold. We don't have a disease issue here. We have a management issue. Sows are overweight. That's a management issue. Sows are skinny. That's a management issue. Sows are wormy. Sows are mangy. Whatever it may be. Use your veterinarian. Get them on the ground. That's what we tell a lot of our clients. It's a good rule that in Ohio you have to have a veterinary client-patient relationship.
Gotcha.
And we do that annually. So it drives me insane when I have to go to farms for a VCPR. Like, I don't have anything you need to look at, doc. I'm like, well, we drove 2 hours to get here. So we're going to walk through everything, and I'm going to find something to talk to you about because there's always somewhere there's room for improvement.
Okay.
So ventilation, the biggest thing is ventilation we see. So not moving enough air in the winter and or moving too much, but most times stuff is too tight, causing pneumonia. Things are too cold, things like that. Husbandry, management. That's my number one thing. Using your veterinarian, if you don't have one, find one. You got to get drugs, and you need to be instructed how to use them. Draxin does not fix everything, nor does just Banamine and dexamethasone.
Okay. All right. Well, we have exhausted. No, I'm sure we have not exhausted the information of Dr. Price, but we have exhausted our time. And so we really appreciate you coming in here, having a conversation with us, Dr. Price. There were lots of questions. There's still some questions in the chat, but we are just going to have to cut it off because we have our next session. And I know you've got other things to do as well. So thank you again so much for your time. We just really appreciate it.
Yeah. Thanks for having me.
Sounds good. Sweet.